Okay. Hello and welcome to the Waltham Public Library's program on the 1918 Spanish flu, the pandemic before this one. My name is Deborah Hoffman and I organize programs and events for the library. Thank you so much for tuning in. Before we start, I want to let you know how the evening will go. Hello. And welcome to the Waltham Public Library's program on the 1918 Spanish flu, the pandemic before this one. My name is Deborah Hoffman, and I organize programs. Okay, sorry about that. Before we start, I want to let you know how the evening will go. Our speaker will do about a half-hour presentation, and then he'll field questions. To ask questions via the chat function, use a Google account to sign into YouTube. Feel free to write your questions at any time, and then I'll read them at the end of the presentation. Dr. Jeremy Brown is the author of Influenza, the 100-Year Hunt to Cure the Deadliest Disease in History. He is also the head of the Office of Emergency Care Research at NIH. But today, he's not speaking on behalf of the NIH, but as an author. Take it away, Dr. Brown.
Okay, thank you. And just a sound check, you can hear me okay?
Yes.
Okay, perfect. Well, good evening, everybody. And it's a special treat for me to be speaking to the Waltham Public Library. I spent 4 very delightful years in Boston, living both in Brookline and Newton, not too far from Waltham, back in the 1990s. And so it's a real treat to be back, as it were, virtually in Boston and specifically in Waltham to talk to you about something that happened 101 years ago, but perhaps could not be more relevant today. I wrote a book, Influenza, the 100-Year Hunt to Cure the Deadliest Disease in History, to mark the 100th anniversary of the Great Flu pandemic of 1918, not knowing that just a year and a half later, we would be facing an entirely different, but in many ways similar pandemic to what happened 100 years ago. And as I thought about this, it became clearer and clearer to me that there are many similarities and many differences between what happened then and what is happening today. So what I'd like to do, first of all, is just to talk to you a little bit and explain what happened in 1918 and why we think that it was of a different order of magnitude, a different scale than the outbreak that we had, that we currently have. Every now and again, I'm going to show you a couple of slides that will give you a flavor of what was going on back then, and then I will switch to other views as well. So this will be your first slide, and let's jump right in. What exactly happened in 1918 and why do we refer to it? So first of all, let's put the numbers in perspective. Worldwide, there were between 50 and 100 million deaths. We will never know the exact number. In the USA, there were 675,000 deaths, 5 times the number of US servicemen killed in World War I. And if you put that in today's numbers, that 675,000 people back in 1918 would equate to about 3 million people in the US dying. So it was a remarkable pandemic in its scope. There was barely a country on the planet that was not in some way touched. The disease spread all the way from Bering in Alaska in the north to Russia, all the way south to Australia and New Zealand. Probably the south, probably Antarctica was the only continent on which there was no flu pandemic. So I want to focus on 3 topics or problems that faced us with 1918. The first thing I want to talk about is how our treatments have changed. The second thing I want to talk about is how our understanding of influenza has changed over the last century. And the last thing I want to talk to you about are vaccines. And then we'll switch and we will take a look at the at COVID-1918. So COVID and comparing it to 1918. So back in 1918, when they were asked what the cause was, they had no idea. You have to remember that viruses would not be discovered for about another 20 years or so. So although the word virus was being used, it meant something mysterious out there, and we don't really know what it is. So they had no idea. And I think in many ways, this is the most scary part, at least as we look back on it, of the pandemic, because if you put it to something that we can all remember before the present pandemic, if you think about the 1980s and the HIV pandemic and the panic, it was clear from the very beginning that this mysterious disease, which became known as HIV, had to be a virus. It just took 3 years to discover what it was. But compare that to 1918, there was literally no idea what it was that the cause was. And to put the death rate into perspective, I want to share this graph with you. You can see here that there was that the disease influenza typically is most dangerous for the very young and the very old, and that's you get this U-shaped graph or curve in the middle, where the majority of deaths occur in the very young and the very old. Now, what we saw in 1918 was this spike in the middle, going from a U-shaped curve into a W-shaped curve. And this spike represents the deaths that occurred in the middle age group, in the age group of the young, very healthy, otherwise healthy people, the working public, as it were. And you can see there was this unusual bump in deaths in that age group. Now, the death rate in 1918 was actually remarkably higher than in previous years, and I want to put this to you in perspective. In our own time, about 2 years ago, we know that the death rate from the opioid crisis, which before we were facing COVID was certainly on everybody's mind, the death rate from the opioid crisis caused for the first time a drop in the average life expectancy in the US. And the drop was a terrible drop, but it was 0.1 of a year, 1/10 of a year. What we have in 1918 was not a drop of 1/10 of 1 year, but a drop of 12 years. The average life expectancy in 1918 dropped by 12 whole years, 120 times greater than what we had seen what we saw in the opioid crisis. So that really gives us a marker, as it were, of just how great this tragedy was. So let's turn first of all to the treatment for influenza. What did we have back in 1918 to treat influenza? Well, what we had back then were mercury, tree bark, factory gases, whiskey, enemas, and bloodletting. That was basically it. I want to just focus on the last one for a moment, bloodletting. Bloodletting dates back to at least the 5th century BC. It involves removing blood, which was one of the humors, the 4 humors thought to sustain the body, removing blood in order to rebalance the humors. That's where we get the word dis-ease from. It's a dis-ease. There is an imbalance of the humors, and we need to put those back into a balance. And so what had been going on for basically 2,500 years was that people thought bloodletting was good for virtually all diseases and for the prevention of many diseases. Well, remarkably, I found in my research that bloodletting was actually used in the great influenza pandemic of 1918 in the lifetime of our own great-grandparents and great-grandparents. In fact, it was reported in a journal in 1916, in a previous smaller wave of the influenza pandemic, that British doctors had actually tried bloodletting on some of the troops who had come down with influenza. And they reported that the only reason they thought it didn't work, they noted it didn't work, but perhaps they thought they were doing it too soon, too early, perhaps they thought they were doing it too late in the course of the disease, that they needed to do it sooner. And this report of bloodletting being done by British physicians on British soldiers was actually published in a very well-respected journal to this day. It is published, it's called The Lancet, it's published in London. And of course, the word lancet comes from the very implement that the bloodletters would use to open up a vein and allow blood to be removed from the body. So even in 1916, people were trying bloodletting as a way to treat influenza. This is just one example, I think, of how far we have come, thankfully, in our treatments of influenza today. Another drug that was used was quinine or quinine. Now, quinine is a useful drug for malaria, but it is useless as a treatment for influenza. Despite that, it was used quite often for influenza, and it is of interest to me that today in the coronavirus era, we too have had some interest in an anti-malaria drug, hydroxychloroquine, which is different. That's quinine comes from the bark of a tree. Hydroxychloroquine is manufactured, but both were anti-malaria drugs. And in 1918, and here we are in 2020, both were sometimes used or often used to treat influenza, even though they actually really did not work at all. As an example of just how difficult it was to treat, or what patients went through to treat their influenza in 1936, I'd like to read you the nursing records of a patient, from 1936. That's 18 years after the influenza pandemic, and these records were saved as a family heirloom and were published later by, I believe it was the grandchildren of this patient. So I'm reading this from my book. It's on page 16 of my book. And this is a gentleman who was treated at home for influenza. Over a period of 3 weeks, the report goes, he was treated with a punishing battery of balms, mustard plaster, a home remedy that was rubbed on the skin, aspirin for fevers, codeine for cough, phenolphthalein, which is a cancer-causing laxative, cough medicine, camphorated oil, 7 enemas, rectal tubes, don't ask, milk of magnesia, another laxative, God help him, urotropine, which is a bladder antiseptic, and tincture of benzoin. The patient that we're describing here in 1936 received at least 5 prescribed doses of whiskey and 14 doses of castor oil. Actually, it turns out that the 7 enemas that he received may have been medically necessary because he was given at least 39 doses of codeine, which certainly suppresses coughing, but also causes constipation. So you can see that back in 1936, 18 years after the great influenza pandemic, doctors were attacking influenza with a number of folk remedies that were at best useless and at worst absolutely poisonous. Today, of course, you're likely to be treated in a very different way. No one is going to take your blood. No one's going to give you an enema to treat your influenza. Of course, we treat it in different ways. Most of the time, even in the emergency department where I've worked for many years, the treatment for influenza is supportive. That is to say that we're really supporting the patient, keeping them hydrated, and making sure that their fevers are controlled for their comfort. And of course, we now have antibiotics, which do not cure the influenza itself, because influenza is a virus, but rather they can attack the bacterial infections, the secondary bacterial infections that often follow from influenza. And we also have a few antiviral medications that actually can attack the virus itself. These are not very good in influenza. We're hearing a lot about them for the current pandemic, but we certainly have a few of those, and we can talk about them maybe later if we have the time. So the treatments have changed a great deal. The second aspect that I want to talk about is how understanding of influenza has changed over the last century. And as I said, I think this is the most frightening aspect as I think about what it must have been like to live back in 1918 through the pandemic. Nobody had a clue what it was that was killing them. And that doesn't mean that people hadn't put together a number of suggestions. And the first suggestion, which is perhaps the oldest, is that influenza is caused by a conjunction of Jupiter and Saturn or some other misalignment of the planets and the stars. And in fact, the word influenza comes from the Italian influenza, meaning influence. So the idea was that the planets and the stars influenced the diseases that you were coming down with on Earth. And so this disease was labeled influenza long before we had any idea what was causing it. It could be identified, like many diseases could be identified before we even knew what the cause was. So that is one theory. There were other theories that there were rotting animal carcasses were the cause, that they were caused by earthquakes or volcanic eruptions, that they were, that there was what were called effluvia that was discharged from the bowels of the earth. But one public health official in the middle of the pandemic wrote that we quote, "We may as well admit it and call it the X germ," he said, because people had no idea what the actual cause was. Other theories that were provided go back to perhaps 1892, when a new bacterium was identified, and it was given the name Bacillus influenza. And the doctors who identified it thought that it was the cause of influenza, so they called it Bacillus influenza. Now, actually, it was not the cause. It was a secondary pathogen. It was a bacteria that invaded the lungs that had been weakened by the influenza virus. And so what they had, as one historian put it, what they had discovered was basically an authoritative sign pointing in the wrong direction, that the Bacillus influenza wasn't the cause, but it was a secondary bacterial pathogen. And incidentally, later this bacillus was renamed Haemophilus influenza, or H-flu. And that is where we get H-flu from. You may have heard of H-flu. We have vaccines against it today. And it's interesting to note that, of course, it's called H-flu, Haemophilus influenza. It has nothing to do with the cause of influenza, but it was once thought to be just that. There were also theories that it was tainted Russian oats that were the cause of the influenza pandemic. And it took a while to figure out exactly how this might be spread. I just want to share with you one ingenious way that they went about thinking about this. A doctor called Henry Parsons actually wrote a report on the 1889 pandemic, and he reported to Parliament, and he actually described a very interesting and simple sort of epidemiological study that he did. He looked at the railways and the number of people employed by the British Railways who were taken ill or who died, and he compared two groups. One group were the people who sold the tickets at the ticket counters, and the second group were the drivers and the engineers who worked in the front of the steam trains. And of course, there were two ideas here. Was it some kind of poison that was in the air that was poisoning everybody, or was it transmitted person to person? And Parsons said, look, if it's a poison that's in the air, then the engine drivers should be most likely to come down with the disease. After all, they're outside and exposed to the outside conditions all the time, as opposed to the people inside. If, however, it's a disease that is spread from person to person, then we should see more disease in the people selling tickets and interacting with the public all day, and we should see less disease in the engine drivers and engineers. And that is precisely what he found. And it's a very elegant example of how you can use simple data to answer very important epidemiological questions, even when you don't know the cause of the illness. Parsons also suggested actually back then that it was transmitted perhaps by animals, perhaps by birds. And of course, he was very prescient then because indeed the great influenza pandemic began as a bird virus that was transmitted probably to pigs and then spread into humans. Of course, today we know that the disease influenza, just like coronavirus, was caused by a virus, which is about 20 or more times smaller than a bacteria. They were isolated in 1939. They were actually identified with an electron microscope. And about 70 or 80 years later, and I tell this story in the book, and it's a thrilling story of how this actually occurred, but scientists were able to resurrect the 1918 flu virus from Alaska, where some victims had been buried and their bodies preserved, and were able to, using the very new genetic techniques of the late 1990s and early 2000s, were able to identify the complete genetic code of the virus. But it took about 70 or 80 years after the initial disease for us to actually know that. Of course, again, very different to coronavirus today. And finally, just as we focus, and there is, of course, so much to talk about, so much of interest, I think, to talk about, we talk about the vaccines and prevention. And of course, there's a lot of talk today about the coronavirus vaccine. So there were, of course, vaccines back then, even though we did not know the cause of these things. Louis Pasteur had famously invented, really, or just a vaccine against rabies. So there was an idea of vaccinating people. And actually, in 1919, and Edward Rosenau from the Mayo Clinic took 5 different kinds of bacteria and inoculated them into 100,000 people. Again, it didn't work because it wasn't the cause. The bacteria were not the cause, it was viruses. Another interesting story that I tell in the book is of a Tufts College Medical School professor called Dr. Timothy Leary, who actually blended a vaccine using the strains from the Chelsea Hospital and a doctor's nose from the Carney Hospital, which is, as you know, in South Boston, and Camp Devens. And this Dr. Timothy Leary took this mixture of sputum and he made a vaccine out of it, and he actually took it to San Francisco, where he vaccinated about 18,000 people. Now, if you're wondering, is this Timothy Leary any relation to the other Timothy Leary, who became a physician and experimented with psychedelics and came up with the phrase "turn on, tune in, and drop out"? Yes, this Dr. Timothy Leary was the uncle of the second Dr. Timothy Leary of psychedelic fame. So people were trying vaccines, and they did not work, and we know why they didn't work. Now, we have a vaccine for influenza today. It's not a very good vaccine, as any public health official will tell you. And of course, as you probably know, it has to be given each season, which is quite unlike the vaccines, for example, for mumps and measles and rubella. We get 2 or 3 shots as a child, and then we're good for life, essentially. A flu vaccine has to be given every single season. And at best, it is only about 50% effective. So you can get the vaccine and still come down with influenza because you may have been attacked by a strain of influenza that was not in that vaccine that you had. And the flu vaccine, therefore, is something that we are still working on. A lot of government money is being spent trying to find a vaccine that will work for influenza. And we still don't have one that is really good. As I said, at most, it's about 50% effective. And in many, many years, it's actually only perhaps 25 to 30% effective. And of course, we have been looking for a vaccine for HIV for upwards of 40 years. And although it was promised to us by health officials way back in the 1980s, we still don't have that. So if you'd like, we can get into exactly why that is. But it is a sobering thing to remember as we talk about the hunt for influenza, for the COVID vaccine, that this thing can be really quite elusive. So what I want to do now is just pivot for a few moments before we open this up to questions from you. And I really want to now pivot, not from describing the 1918 virus of influenza virus, but really the differences between what we are experiencing today in the present pandemic and the outbreak 101 years ago. Many people have claimed that there's a similarity, and there are some similarities, of course, but we need to really look a little deeper, and I think you will see why, at least for the moment, at least as we're talking today, this is not another 1918 pandemic. As I've mentioned before, as the influenza pandemic ravaged communities from California to Calcutta, nobody knew what it was that was killing them. There were all these theories around, and they were all wrong. And in fact, it wasn't until 1933 that two British scientists demonstrated through some elegant experiments that they had isolated, as it were, what we call today viruses. And in 1940, the new electron microscope could actually take a picture of the virus. And so for the first time in history, we could not only name the virus, the culprit, but we could also see it. Now, the contrast to COVID-19 could not be greater. From the very start of this outbreak, scientists knew that it had to be a virus. In fact, within 2 weeks, just 2 weeks, they had identified the coronavirus and sequenced its genome and discovered as well that the most likely host were originally in bats. And this information was published by a Chinese team, as I said, within about 2 or 3 weeks of the first cases being announced. And the contrast couldn't be greater. We knew, so that therefore we knew what the virus was, and we knew its genetic structure, and we knew all that within about 2 weeks to a month of the first reports of the outbreak. If you remember, in 1918, it took till about it took about 80 or 90 years for us to have anywhere near that level of knowledge. The second important difference that I want to share with you is that the great influenza pandemic occurred in the pre-antibiotic era. We mentioned this as well, but it's worth thinking about that. Although antibiotics, as I said, do not treat viruses, they do most certainly treat the secondary infections that follow influenza, and they can also be useful to treat the secondary lung infections that can sometimes follow severe COVID infection. Now, of course, antibiotics were not really discovered until the 1940s and became sort of generally used in the 50s and onwards. But we certainly have a world today that is flooded with antibiotics. And although there is, of course, a concern that bacteria are becoming increasingly resistant to antibiotics, they remain a very powerful tool for us to treat secondary bacterial infections. And so, although these cannot provide a cure for COVID, they can certainly treat the secondary infections that sometimes occur in severe COVID infection. Of course, another difference is not the antibiotics, but the antivirals themselves that directly target the disease. Now, these are not as effective as we would like, but some of them have been used. Remdesivir is one of them. Some of them have been used in a limited number of very sick patients. And there's simply a lot to be learned in this area, but at least we have some options that were simply undreamed of a century ago. A third difference between the 1918 influenza pandemic and today is the role of the hospitals and intensive care units and medical specialists play. Now, during the 1918 pandemic, hospitals really offered very few interventions. As you may have seen in those earlier slides, patients were put together, were treated together, dozens or hundreds of them, where they lay coughing, separated from one another by only a flimsy cotton sheet. Today, of course, it's very different. We understand infection control. We understand the need to prevent cross-contamination. We now have intensive care units that can treat the sickest patients. It is true not all will be saved, but many will. We have learned how to prevent the need for many patients to go on respirators, but they are a last line that we can use to hold over some patients and help with their oxygenation until they can recover. And we even have a machine called an ECMO machine, the extracorporeal membrane oxygenator, which basically takes over the job of the lungs when the lungs are too sick to do their job. Now, to be very clear, the ECMO is a last-ditch effort, and it's the medical equivalent of a Hail Mary pass. But it has worked, and I've spoken to colleagues, physicians who have used it and seen some quite remarkable recoveries, although, as I said, it's a last-ditch heroic effort. So we have the hospitals, we have intensive care units, and of course we also have experts in various branches of medicine that we didn't have a century ago. We have experts, physicians and nurses in emergency care, intensive care, in infectious diseases, in pulmonary problems, as well as respiratory techs, and expert intensive care unit nurses and nurses who work in emergency departments. This again was unheard of 100 years ago. The doctor who looked after you 100 years ago could basically set your broken bones, deliver your baby, and possibly remove your appendix. And that was basically all that your doctor had. And whether or not your physician is, whether the specialist is an emergency physician who first diagnoses and treats you, or the nurse who cares for you at the bedside, or the infectious disease specialist who help fine-tune your medications, or indeed the respiratory therapists who help rehabilitate your damaged lungs. And none of that would have occurred 100 years ago, and the patient the sick patients would generally die unnoticed in the corner of a busy and overcrowded ward. So those, I think, are some of the important differences that we have when we think about the COVID pandemic of today and what happened in 1918. I'd be happy now to open this up to questions. And of course, I'm happy to go into more detail about any of these topics that we have, out of necessity, spoken about very quickly. I look forward to interacting with you as best we can over Zoom. Thank you.
Excellent. Thank you. That was fascinating. We do have some questions for you. One is, and I hope this makes more sense to you than it does to me. Can you comment on the different results during the 1918 pandemic between Fort Devens and cities like St. Louis? I guess they're talking about the different impact of the Spanish flu.
Yes, I think what this really comes, the question is, Fort Devens was one of the many army posts, army forts, camps really, that came down where huge numbers of army recruits became sick and died. In fact, it might be sobering just for a moment for me to read you a report that, let me just find this because it's really quite chilling. This is a report that was written by a, let me just find this, here we go. By a physician called, where is it? Well, I'll come back to it in a moment. Yes, here it is, excuse me. Okay, it was right in front of me. So this is a report by Victor Vaughan, who was a prominent physician in the university and the dean of the medical school at the University of Michigan. And here is how he described visiting those patients in the field hospitals. He said, quote, "I see hundreds of young, stalwart men in the uniform of their country coming into the wards of the hospital in groups of 10 or more." And this he wrote in his memoir, and he continued, "They are placed on the cots until every bed is full, and yet others crowd in. The faces soon wear a bluish cast. A distressing cough brings up the blood-stained sputum. In the morning, the dead bodies are stacked about the morgue like cordwood." And Vaughan was humbled by this plague that he simply could not treat, and the way that it was attacking the soldiers in the various army camps. And he wrote, "The deadly influenza demonstrated the inferiority of human interventions in the destruction of human life." And that was how Victor Vaughan wrote of the 1918 virus in his memoirs that he published many years later. But you've also asked a little bit about the different death rates in different places, and you mentioned Philadelphia. It's a complicated question, but I'll just break it down into, I think, a couple of easy to remember things. Although we didn't know that that the virus, that there was a virus that was responsible, it was generally understood that influenza was spread by close contact. Indeed, we saw that from Henry Parsons and his work in the British railway system. And despite this general understanding that it was passed from person to person, and that's why there were these ordinances against that you had to wear masks, and you shouldn't spit in the street, and people were arrested if they spat in the street, because that could spread the disease. Despite this, there was no ban, at least for a while, on large public gatherings. And the classic example that you will hear is that of the city of Philadelphia, that in September of 1918, and I talk about this in the book as well, in the midst of the war effort and the influenza pandemic, the city of Philadelphia held a Liberty Loan parade, and local newspapers reported that about 100,000 people thronged into the streets of Philadelphia as a show of support for the army and for the war effort. However, deaths from influenza quickly spiked, and soon, within a few days of this, upwards of 100 people were dying in the city of Philadelphia every single day from influenza. And what had happened was the Liberty Bonds March had actually liberated the virus. And now, in contrast, and again, this is a well-described story. In contrast, the city of St. Louis canceled its same parade. It was also going to hold a Liberty Loan parade, but it canceled it, and also introduced a number of public health measures to promote social distancing. And as a result, the excess mortality rate in St. Louis was less than a third the rate in Philadelphia. So you can see that even in 1918, there was an understanding of the importance of social distancing. There was an understanding that we need to take efforts to keep people apart. And there were many examples of this in 1918. Trams were staggered, the number of people who were allowed into stores was staggered, and the time that you could shop was staggered, and many schools were closed. And all of this was to prevent what we now call social distancing and the spread of the disease. And so I think what the question really comes to is, how do these measures of different ways of social distancing, either having school closings or not having school closings, how do they impact the disease? And the answer is that they certainly impact the disease and the spread of the disease as well. So I'll end there.
Great, thank you. Let's see. We have another question. Are there similarities between how COVID-19 and the Spanish flu is transmitted or spread? And I think actually you've kind of answered that.
Yeah, well, there's a couple of other things too. So let's think about, they're both viruses. They're both winter viruses. So influenza tends to go away in the spring and summer. It tends to go away in the spring and summer and come back in the fall. That's why we have. That's why we get our vaccines seasonally. Coronavirus is a well-described virus that causes winter coughs and colds. Most of the people listening in today will have had a coronavirus infection if they've ever had the coughs and colds or sniffles. It too is a winter virus, and should have gone away in the spring and summer if it were to act like influenza. Unfortunately, it did not do so. It's one of the ways in which COVID is not acting as a typical winter virus thus far. But there are some other similarities. As I said, we know that influenza began as a virus in birds, was then the virus then was spent some time in a mammalian host, likely pigs, or perhaps other farm animals, and then it was transmitted into humans. And as it went from bird to mammal or to pig to human, it assorted its genes and it picked up different kinds of flu virus, because there are flu viruses that affect birds, there are a few viruses that affect animals, and there are flu viruses that only affect humans. But this allowed an assortment, and so you came out with a novel, with a new influenza virus that we later called H1N1, and that was what caused the 1918 pandemic. Now, we know, and we knew this very quickly, that the coronavirus originated in bats. So it had an original host. It then was transmitted, it was likely transmitted through an intermediate host. In this case, the most likely culprit is thought to be the pangolin, which is a very cute anteater, an endangered species. Most people think that was the intermediate host, although there is some conflicting evidence, but generally it went from bats to pangolins to people. And in the same way that influenza traveled in this way, this is the way that COVID came into the human population.
Here's a question for you. How similar is the genetic code of the 1918 flu to our modern influenza?
Okay, so that's a wonderful question. And of course, it depends on what you mean by our modern influenza, because each season we get vaccinated, for example, against at least 3 strains. Usually the vaccine contains at least 3 strains of influenza that we think are going to be the most common ones that will attack us. How do we know this? Well, what basically scientists in the Northern Hemisphere do is they look and see what happened 6 months ago in the Southern Hemisphere, in Australia and New Zealand, where it was their winter during our summer, and what viruses were circulating there. And they take another look at other places and Australia, and they put together their best guess as to what the influenza viruses that will attack us in this winter are likely to be, and they make vaccines against them. And all that has to take place, and takes at least 6 months to do all that. And sometimes the doctors and the scientists are right, and sometimes they're wrong. And so it's not always as precise as we'd like, and therefore you can get these vaccines for influenza and that yet come down with flu, and that's because you got a vaccine. The vaccine likely worked, but you came down with a different strain. So when we talk about how similar is 1918 to modern flu, we have to remember that there are different strains. But, and this is, I think, is a surprising thing, then the original 1918 virus, which was an H1N1 virus, is circulating today. It is a common cause of influenza, and there is no doubt, there are many scientific papers written on this, that at least one strain of influenza, the H1N1, is a direct descendant of the original influenza pandemic, with relatively few changes to its genetic code. And in some cases, it was actually identical. And so it's become part of the normal flu viruses that attack us each year. So surprisingly, we are still undergoing, if you like, infections from the same or very similar strains of virus to the H1N1 of 1918.
Wow. How did the ongoing war impact the spread of the virus in 1918?
Well, you know, this again depends on where you were. Remember, America only came into the war in the late 1917, so it had only been fighting for, you know, less than a year, probably, or just around a year, when the 1918 virus exploded. Other countries in Europe, France and Great Britain, Germany, had been at war for 3 or 4 years by now, and of course they were tired, and it was quite an important feature of the war. There are accounts that I have in the book of Germans reporting that their whole units were unable to fight. Similarly, the same is true of the Allied soldiers. Certainly, shiploads of troops being transported both to Europe and from the European theater back into the United States came down with influenza, as we've mentioned, and there was a certainly a significant effect. There are other ways in which the 1918 virus affected the war, and that's the story of what happened at the end of the war with the signing of the, I believe, the Paris Accords, the Treaty of Versailles, excuse me, and how the President of the United States, when he came down with influenza, and how he changed his approach to German reparations. It's a very interesting story, and it is likely that the United States agreeing to much harsher terms than the Allies than they had wanted, and basically placating the Allies, led to the very harsh terms at the Treaty of Versailles, which led to German unrest and perhaps certainly the outbreak of the Second World War. And all that was because the President of the United States came down with influenza and wasn't able to fight his case. But I want to talk about one other aspect of the war that likely had an effect. And this is the way that the disease was reported in the press. Now, it is true that most of the time, influenza was certainly reported, and some of the times it hit the front pages, but that was not the majority. And in fact, most of the time, the disease was, reports of the disease were buried inside the newspapers. Why was this? Well, the reason was that there was a tacit agreement between the newspaper editors and the governments of the West, of the Allied powers, not to overly report this epidemic. There was certainly no censorship, but there was the reports were somewhat suppressed. And I'm going to show you an example in a minute. And in fact, the word Spanish influenza comes precisely from this phenomenon. The disease certainly did not begin in Spain. In the book, I talk about 3 possible places where it did begin, including one that was in Haskell County in Kansas. But everybody agrees that the disease did not begin in Spain. So why is it called the Spanish influenza? The reason is that Spain, if you remember, was a neutral country. There was no censorship. And so it was in the Spanish press that the first reports of influenza, both in Spain and also across Europe, that's the first place that they were published. And they were not, they were not published that early in the newspapers in the United States and Great Britain. And so the name for this disease became Spanish influenza, not because the disease originated there, but because there was no censorship in Spain. Spain was a neutral country, and so it could freely report the outbreak as it occurred. So that shows how I think the war and the war effort directly impacted on what the disease came, or one of the names that the disease eventually came to be called by. Now, I want to share with you on my screen, and hopefully you can see this. Let me just do my screen share here. And this is a really fascinating document that comes from the Washington Post on Sunday, December 8th, 1918. Now, this is actually, I think, the back page of the newspaper. You can see to the right, there is a big ad for dining suites and mahogany chairs. And you can see above, on the left, that there is an ad for a honey for coughs and colds. And then you see what I've circled, what I've highlighted in red. Spanish influenza, more deadly than war. It is said that the epidemic cost more lives than Americans lost in battle, and the danger is not over. Great care is needed to prevent further outbreaks. Now, when I read this, of course, I thought, wow, that is a hold the front page headline. I think all of us can agree that a headline like this, that the pandemic that we are currently experiencing, because remember, this was in December of 1918, the pandemic would go on for at least another month or so, that the news that this disease had killed more people than had died fighting in the United States, you'd think that would be front page news. It was buried in the Washington Post on the very last page in smaller print than an ad for attractive dining room suites and mahogany chairs. And I think this really goes to emphasize how the news about the pandemic was really, as I said, it wasn't censored, but it was relegated many times to places that today seem absolutely puzzling to us. How could it be that this only came on the back page of a newspaper? It's such a startling statistic. Once again, I think this is an example of how the war and the war effort impacted the way that influenza was reported.
Fascinating. So I noticed that you showed a lot of images of people wearing face masks. In fact, I think in every picture. And I'm wondering if people in 1918 had similar resistance to public health suggestions like wearing face masks or social distancing.
Yes, and the answer is absolutely. There was some resistance. It was limited, but it was definitely there. And I think the example about this is really from San Francisco in late 1918 and early 1919. There originally the Board of Health had issued requirements for everybody to wear masks. The disease seemed to be going away. So there was a question of whether they would rescind the mask wearing ordinance, and they did. And then the disease picked up again, as it so does when we let down our guard. And that caused the Board of Health to once again to want to enforce the wearing of masks. This was late December of 1918 and early January of 1919. And there was a movement in San Francisco of really a rebellion, a citizens movement against the wearing of masks. And the reasons that these people gave for their dissatisfaction and their rebellion against this, that the masks was very similar to the reasons that we hear today. They said it was an infringement of their liberties, and they said that it was unpleasant and it was an infringement of their liberties. And indeed, the movement was against wearing masks in 1919 was really spearheaded by libertarians, a couple of physicians who went against what was clearly the widely accepted medical standards of the day. They said, we also don't need to wear masks. You can always find a physician who will go against the grain. That's not a hard thing to find. And so what happened was, as I said, they protested at the meetings of the health department, and the health department actually did not go ahead and reinstitute the masks until the situation became untenable, and only then were the masks reinstituted. This also was a time when a bomb was left outside one of the senior health officials for the health department in San Francisco at the time. And the question is, who left it for him? Most people would think that it was, again, the anti-mask wearers who were fed up with the mask ordinances. So it is strangely true that many features of COVID, and many of the social features of COVID that we are experiencing today, have already occurred either in the 1918 outbreak, or certainly in earlier outbreaks of cholera, in which, for example, were in the United States in the 18 and early 1900s. And those cholera epidemics were blamed on foreigners. We've seen that. And indeed, going all the way back to the Great Plague of London in the 1660s, where the belief was that it was brought in by the French. And so you see, I think, throughout these various examples of pandemics, that we see repetitive aspects of human behavior, the blame of the other, the rebellion against what are very sensible medical ordinances, the use of quack medicines, and so on. You can see these patterns over and over again, very sadly, but that's the way it is.
It does sound very familiar to what we're living through. Let's see. What do you feel like are the lessons that were learned from the 1918 flu that we can use today?
Well, that's a very interesting question. The lessons, of course, it wasn't the first time that we had experienced a pandemic. Far from it. In fact, death was a very real part of life in early America, in America in the 1900s, in all societies, particularly death from infectious disease. In fact, I have a medical paper that was published, I think, in the late 1890s, which asked people what they feared the most. And the things that people feared the most, the diseases that they feared the most, we don't even know what they are today. So people feared diphtheria, they feared whooping cough, and a couple of others. These diseases have vanished because of vaccines. Despite despite that vanishing back in that time, 100 years ago, infectious disease was part and parcel of life. And I think that's another explanation as to why I think that the influenza wasn't quite as prominently featured. While it took unprecedented numbers of people, it wasn't strange for society or for towns and villages to have an epidemic run rampant, which is quite different, of course, today. So in terms of the messages of 1918, we're looking back on those, of course, and we're trying to tease out what they are. As I said, there are certain similarities. I wouldn't call them messages, but there are many similarities between what we are experiencing today and what happened in 1918. And there are, of course, certain behaviors that are sadly we see over and over again. Another example of a behavior was a race riot that occurred in Philadelphia when some African Americans were attacked. There was a whole problem of housing, and some African Americans had moved into a white neighborhood, and there was a race riot right in the middle of the outbreak of influenza. And of course, sadly, we have seen today exactly that with our own not really riots but protests. And to some degree, public disorder over the treatment of minority communities. And so, again, we might think that that is unprecedented and a novel feature of what it is that we're going through today. But unfortunately, it too was first described in the 1918 epidemic.
So, as someone who has researched extensively the 1918 experience, do you feel like you can practically predict what's going to happen next?
Yes, well, no, I don't. I think prediction, is very hard. I certainly could. I think anybody who reads history could sensibly predict that there would be another outbreak of a virus. It was just a question of when. Anybody who reads history would know. As I said, going all the way back to the 1600s, pandemics of smallpox, pandemics of malaria in the United States and in the colonial times, outbreaks of cholera, and so on, that certain human behaviors will be seen over and over again. And we, unfortunately, are seeing just that. So it's not necessarily the influenza pandemic of 1918 that we should turn to when we think about these questions of how do humans generally behave, at least in the United States, in the West, how do we generally behave? We should also turn, I think, to other diseases and other times to look for and predict behavior. And I'll just leave you with one example. During the smallpox outbreak in Boston in the 1600s, there was an ordinance that everybody had to place a flag on their house if they come down with the disease and make sure that everybody was quarantined. Quarantine was a well-known way of preventing the spread of disease. And the ordinance in Boston said that that if the household could not provide for the care of the person who had come down, that it would fall on the city itself to provide a nurse to aid in the recovery of the person in the house that had been quarantined. So 400 years ago, we were talking about the need for public assistance for those who were most tragically hit. And here you could imagine the most socio-economically deprived people, that they would get some form of assistance from the help of the government. And I think that, to me, is another parable, if you like, of what we should be thinking about as we face this pandemic. That can we not do as well as our ancestors and forefathers did 400 years ago to provide relief from the disease through the public purse, and to make sure that everybody, whatever your income or socioeconomic background or whatever your ethnicity is, that you could all be treated. And I think if we remember that what happened back in the 1600s, at least insofar as the members of the Boston, the early Boston town and settlements were at least as far as they were concerned, the public support, public health needed to be provided by those with resources, and if it came down to it, by the government itself. I only hope that we can be as clever and as sensible as they were back then.
That's a great insight into how we should be looking at this. We do have more questions. We are also at 8 o'clock, so I don't want to hold you, since I told you this would be an hour. If you feel like you can field a couple more questions.
Yeah, why don't we start? I do have to go fairly soon, but sure, I'll be happy to take a couple more questions, absolutely.
Okay, great. Let's see. Let's see. You talked about that a little bit. What is the disproportionate impact on minority communities in 1918 versus now?
Well, it should come as no surprise to anybody that that the 1918 pandemic hit minority groups and the poor to a degree that did not occur, for other people. So basically, the richer you were, the larger your home, and the more likely you were not to pass it on to other people. And so the fewer people, generally speaking, the fewer people died. As I mentioned, we saw the race riots in Philadelphia in June of 1918. But I want to point out that as the influenza pandemic was spreading across the country in 1918, there were, at least in the first wave, which happened in the spring of 1918, there were nearly 70 lynchings of African Americans across the United States. So you can imagine this is taking place at a time of these most vile expressions of rage and violence against others. The African American community not only had to deal with these terrible lynchings that were still part of that still occurred, but also had to deal with the disease itself. There were separate hospitals, of course, for people of color. And in fact, the 1918 outbreak may actually have spurred some advances and sort of new ways of looking at the treatment of the African American community, even in the hospitals that were specifically there to serve them. So today, again, we see the same thing, that it is communities of color that are disproportionately affected. It is people of lower socioeconomic means who are disproportionately affected. There are very simple reasons for this, but we haven't been able, despite over 100 years of pandemic teaching, we haven't been able to tackle this perhaps most awful of aspects of the pandemic, which are, after all, completely within our control as a society to prevent. There's not a lot we can do. Sometimes, if we don't have medicines, if we don't have vaccines, we can work on them, we can try and get them. But it takes months, years, and sometimes, as I said with the example of HIV, it can take 40 years and we still don't have a vaccine. But the way that we come together as a society to take care of the most poor and the most vulnerable, that is totally within our means as a society. And it deeply troubles me that we really have not lived up to what we should be doing there.
Well said. Can you take one more question?
Sure.
Can you talk just a little bit about what the federal response was to the Spanish flu in 1918 versus the federal response today?
Sure. Well, basically, Woodrow Wilson never once mentioned the influenza pandemic in public. And that, I think, tells you a little bit about what the federal response was back then. Never once mentioned it. And indeed, when I looked at this, it was really the localities, the towns, the cities, the municipalities, the counties that really came up with their own policies and procedures as how to proceed. So, for example, in some places in New York City, the schools were shut. In some places in New York State, the schools remained open. We saw in Philadelphia, there was an open, large gathering with 100,000 people in September of 1918. In St. Louis, they decided against this. It was very much a question of what happened locally rather than what happened as a federal response. Indeed, the ability of the federal government to respond in 1918 was very different to the one that we have today. But even having said that, there was no real, as far as I know, federal response. It was all down to the municipalities. Now, there are some contrasts for today, but I think what we have generally seen is that states have been left to come up with the best policies and the best reactions and preventative measures to the virus in their own locality. And I think to a degree that that's correct, because the reality on the ground of the disease, of how many people are being affected, how many hospitals are at overflow capacity, it's going to be very different in New York than it is from Billings, Montana. And it therefore makes, I think, sense for the experts on the ground in the localities to really be moving in response to what's happening locally. Having said that, again, there is, of course, a lot that the federal government can do, if not lead by example. And I'm afraid we've not seen very much leading by example to date.
Thank you. Thank you so much. This was fascinating. We had almost 70 people turn in, so I'm calling it a big success. I am going to end it, but thank you very much for your time and your insight and for sharing your research with us.
Well, you're very welcome. And to everybody, to all the listeners in Waltham and elsewhere, stay happy, stay well. These are difficult things to do, to be happy and to be well in these times. It's very challenging. But I wish you really much strength going forward. And if you're looking for something to read on the 1918 pandemic, well, you might want to check the book out. There's a lot more to the story than we had time to talk about today. Thank you.
Thank you.